Our daughter was coming out of a wilderness program where she had a pretty good reset for 4 months after exhibiting some pretty poor coping skills for depression and anxiety. And so we knew that she needed additional treatment in order to be able to reintegrate herself back into real life and deal with challenges in the modern world. And so we looked at a variety of programs and ultimately chose Turning Winds for her continued treatment. She was exhibiting, it seemed like, a new negative behavior every week. She was engaging in a number of negative coping skills, negative behaviors that were derived from her anxiety and depression. She just did not have the skills to be able to cope in a healthy way. And it was getting to the point where we were really concerned about her long-term safety. Wanted to make sure she was really safe. We decided to get some professional help. We wanted our daughter to be known. We wanted her to be able to work on her self-worth, which turned out to be her primary issue, in a setting where she knew everyone and everyone knew her, and she could feel appreciated and loved. The actual process of getting her enrolled was fairly simple. We spoke with the admissions director, we provided the psychological evaluation, and she was enrolled within like 2 or 3 days. We set an entrance date once we made the decision. Probably the whole thing happened in about less than 3 weeks. Turning Winds has a system where parents visit campus and they get a chance to see the child in their new space. Then there's a local visit where the parents come and take the child off campus. Then they get to go back right away, and they do that a couple of times. And then there's ultimately home visits where the child comes home, and that usually happens a couple of times until finally there's the transition home. Even after the transition home, there's still support from Turning Winds. So that whole program just makes so much sense. I think that patient care was a top priority. Our daughter met with the psychiatrist frequently, and he was in good communication with us. Our child met with the nurses, and there's a psychiatric nurse practitioner and 3 nurses on staff. All of them emailed me and kept in good communication with me. My daughter had a number of physical things going on with her at the time. I felt like Turning Winds went above and beyond on our behalf. One time they drove her 3 hours to go to a larger hospital, and I met them. I felt like that was something they didn't have to do, but they were willing to do it. Really helpful there. Teacher conferences, just overall really good care. I am and continue to be impressed by the small family-like atmosphere. And their ability to react to needs in the moment. I think that the therapists at Turning Winds are exceptional. We've had a lot of different therapists over the years, and the therapists at Turning Winds really understand youth. They understand the mindset that these kids are in, and they're able to work with it. I was having a meeting one time when we came back from a visit, and I looked around and there were 7 staff in the room with my daughter and me, like trying to help us. And it's just like, wow, I don't feel like I could have gone anywhere and had 7 people in the room, like taking care of my child. I felt really good about that. So I think Turning Winds is really exceptional there.